This is the installation tutorial video for the Professional Shockwave Therapy Machine Prime by Canta Esthetic. If you want to remove the handle, press the buttons on both sides of the connector, then pull it out firmly. Rotate counterclockwise to remove the locking ring cap. Align the protrusion on the locking ring cap with the groove on the side of the handle, close it, then rotate clockwise to secure the locking ring cap. Place the silicone head on the stand with the smooth side facing downward. Tap the area to be treated, and the main screen will display the recommended silicone head model. Press and hold the desired treatment area for 3 seconds to enter the help page for that area. Tap the times to return to the main screen. The working frequency range is 0–1 to 10 Hz. The working intensity range is 0–1 to 10 bar. This shows the preset number of shockwave pulses. This is the shockwave counter, which tracks the total number of pulses delivered. Use to set the preset number of shockwave pulses. Pause. Start. You can also adjust the working frequency and intensity from the handle, as well as start or pause the device. When the device is in the start mode, you also need to press the black button on the handle to release the shockwave pulses. When installing the silicone head, apply a suitable amount of coupling gel to the handle first. Operation without gel is strictly prohibited. Insert the silicone head. Press it gently to ensure a snug fit with the handle connector, and twist it slightly to avoid air bubbles. If bubbles remain, more gel may be needed. Attach the locking ring cap and rotate it clockwise to secure the silicone head in place. When performing treatment, apply a suitable amount of gel to the treatment area. Move the handle very slowly and adjust the energy level according to the patient's pain tolerance and feedback. Treatment course: 1-1 treatment interval, once every 3 to 7 days. 2-course reference, 4 to 5 sessions per course, depending on the patient's condition and symptoms. The total number of treatments varies based on the patient and their condition. Most treatment plans involve 4 to 5 sessions of 1,500 to 2,000 shockwave pulses each. 4A's individual conditions and symptoms vary. The number of sessions may be adjusted for better results. Treatment cycles and frequency can be tailored to suit each patient's skin condition and personal needs. Do not perform treatment if any of the following conditions are present. 1 Women should avoid treatment during menstruation, pregnancy, and breastfeeding. 2 Patients with hemophilia or those undergoing anticoagulant therapy. 3 patients with thrombosis or embolism. 4 children who are still growing and individuals with immature bones. Do not treat areas with surgical wounds, broken skin, abrasions, open lacerations, or active inflammation or infection. Individuals with contagious skin diseases or legally notifiable infectious diseases should not use the device. 7 Caution is advised for those who have received corticosteroid or X-ray therapy within the past 6 weeks. 7 People who have been on long-term corticosteroid medication or have liver dysfunction that may cause capillary dilation. Use with caution in patients with severe comorbidities such as malignant tumors, cancer, epilepsy, uncontrolled hypertension, or multiple neuropathies. Any unstable medical or psychiatric condition. Treatment must not be applied to the following areas. 1. Specific tissues: eyes and surrounding areas, heart muscle, spinal cord, reproductive glands, such as ovaries and testes, kidneys, and liver. 2 areas with gas-filled organs or where gas is present internally, e.g., lungs and intestines. Due to the cavitation effect of shock waves, when treating the back, lung area, the depth setting must be less than 20 millimeters. Regions near major nerve bundles, large blood vessels, arteries, the head, and the neck. For any area with sensory impairment, areas containing any type of implanted device, e.g., pacemakers, implanted defibrillators, or nerve stimulators. 6 regions with benign or malignant tissue growth,